I enjoy what I do every day, and I keep myself challenged so that burnout, I don't think, has been an issue for me, on a personal level. But I think within the world of physician practice, burnout is becoming a very significant problem. We're seeing physicians who are having higher dissatisfaction in the workplace. That can lead to disruptive behavior, physician anger management problems, and even in extreme cases, really kind of significant mental health issues. So from a senior management point of view, physician burnout has actually worked its way up organizationally within our organization to be something that's led to a task force formation and something that we, as both management and medical staff leaders, are beginning to address. On a personal level, I think frequently physicians get put in positions that they're really not happy with, and I think all of us went to medical school for certain reasons, and I think as long as we're able to take care of patients, provide value in our lives and value at work, most physicians can deal with almost anything. However, external factors that we can't control are coming into play more and more, making the workplace change quite a bit compared to 10 or 15 years ago.
Yeah, I mean, it's across all specialties. In our institution, it's a major issue. It's the primary care. This is huge because they have so much direct patient care and paperwork kind of issues and very frequent kind of turnover of patients, whereas we can be involved in a procedure for 2, 3, 4 hours and be a little bit insulated. But it's a huge issue, right? And I think the concern that we spend more time documenting than actually taking care of patients is really kind of frustrating.
Yeah, I think it's been well shown that the number one cause of physician dissatisfaction, not necessarily burnout, but just dissatisfaction that starts from, is the presence of electronic medical records and the process, whether it be electronically or paperwork that preceded it, of the percentage of time compared to taking care of patients. And I think that's been one of the reasons that many physicians have sought employment models, those in private practice, which in our country is the principal way that most physicians are practicing still, but to find shelter from all these external influences. And when you actually look at physician satisfaction, let's say, of those physicians who have left the office behind and left it for the right reasons, it's because they can practice full-time medicine, not have to worry about the things that were causing them stress, and in theory have a lot of other things handled by other people. It doesn't work for everybody, but when we look at our primary care docs, our surgeons in particular, proceduralists, as you say, most of us, what we really love is, if you're a proceduralist, is going in, taking care of patients,
getting your hands wet,
helping them, doing the things that give you satisfaction, but also helping our patients and getting that sort of immediate gratification, that goes with the procedure itself.
Yeah, it seems in our environment, the EMR, the requirements for documentation, have actually increased the costs rather than lowering the cost, because we now hire scribes to help you get through your clinic visit, and so that's an additional cost. The monitoring, the IT is an enormous cost. But on the same hand, it's been a huge boon, right? Information's much easier to get. We connect to all the different hospitals, so I can look at hospital records from other institutions, other notes. It's not always easy, but so I wouldn't say that it's been all negative, but it's a huge factor. So what are some of the measures you're doing or pursuing to help keep people from burning out?
Well, I think the first thing, there's process and there's the role of physician leadership. So for those of us that are leaders and responsible for other physicians, whether you're a section chief or a group leader, you really need to be looking for signs of physician burnout. I think it's very much like mental health. Sometimes it can be very difficult to detect if you're not looking for it, but if you do look for it, sometimes you can detect these signs. And one of the things we do is we ask, how are you doing? What's happening in your life? When you see somebody who's spending more time after hours than they should, they seem to have trouble managing their own day and their own time. You as a leader, you have to look out for those sort of things, but also very much talk to people. We're also, in our own institution, developing some outreach programs, making physicians, trying to make them more aware that burnout is a problem. It could affect their performance. I heard an interesting interview on NPR recently, not to give them a plug, but there's a woman who was a go-getter. She'd always been at the top of her class, made it into her residency. She was an OB, and then didn't recognize the signs actually, she was an intern, didn't recognize the signs of burnout until she forgot to order insulin on a diabetic patient that came in and needed insulin. It was a type 1 diabetic. And that was the signal, the signal event that told her something was wrong. Everybody else seemed to know around her, and she wound up basically stopping what she was doing, went to her supervisor, said she thinks that she may not be performing properly. And so I think we recently, and it's not just unique to us, but physician suicides in the clinical space are starting to bubble up frequently in people that look perfectly normal, and we're able to hide this. So I think we have to look for it. It's not, don't wait for it to appear.
Yeah, and one of the concerns I think a lot of us have is that at the training program level, there is a lot more focus on this. The hours of training are very curtailed. There's a lot of wellness. There are wellness days that the medical students are forced to take. Yet the real world is not always so forgiving and understanding, and so it can be really a rough transition, and the burnout can be very quick. It's not necessarily a late career thing. It can be the first year or two in a practice where you're suddenly faced with many more requirements and no one's really protecting you. You've got to protect yourself.
So what does burnout mean, I guess? I mean, it could be resulting in fatigue. It could result in frustration. It could result in anger. It could result in people feeling like they're trapped. And when people start feeling like they're trapped and they're in a situation where they can't get out of it, that's when you start getting into very difficult problems that can affect the workplace, their interaction with everybody else. And so I think it's important to recognize it, but also to understand as a physician, we have options in our life, okay? If the external world is cramping in on you, all right, because of these adverse effects, maybe you should think of another career. Everybody's smart. It could be in medicine. Generally, the people that are burning out are not 30-year-olds generally, although it's occurring with increasing frequency. It's really more in the 50-year-olds and a little bit older. And a lot of it does have to do with this transition in healthcare. Sometimes you can go to a superior and say, you know what, I just can't handle this. I need help. And so we have to we have to recognize it, and we also have to help our colleagues get out of the bind when and if we can.
Yeah, no, I think that those of us that are lived in an old world and now the new world, there is a lot of frustration, right? And you get exhausted trying to, for example, the EMR follows you all over the place.
Right.
I'm getting notifications on my phone at this meeting about open charts that I need to go log onto my phone and close for the EMR. So there's no escaping. Yeah. So but it's a different world. I think we commented earlier today, the generation coming through lives this way. So it will not be as much of a intrusive thing.
Yeah, I find our fellows to be a relief for our attendings. and the fellows' expectations are a lot different. They don't know another world. They tend to be more computer savvy and just take it as a matter of their work and are able to, and actually can provide very constructive input. And we're at the point now where EMRs have been imposed on us for a variety of different reasons. But there has not been enough clinical input in those EMRs. EMRs can provide valuable tools for us. And the available electronics, I mean, personally, I like being able to go on the portal and communicate with my doctor or communicate with my healthcare providers and have all my information in one place. It's interesting, actually, and I don't know whether it's changed now because it's been some years, but at the time that I got involved treating the vice president with the team from GW, there were two people in the United States who did not have EMRs, and we're not going to have EMRs. And that was the president and the vice president.
Interesting.
Right? And everything was paper, and everything was, aliases also, but it was all paper, and everybody carried it. Sure.
Interesting. Yeah. No, I think there's a different expectation, and maybe this is part of the burnout issue. The expectation is for our patients, very quick response, very quick communication. The expectation from our younger colleagues, very quick feedback. They want to know right away what's going, how am I doing, what can I do differently, And it is a shifting paradigm, and it takes a lot of energy to be up all the time and on all the time to respond to this. But as you say, it's a natural for those that are coming behind us. I know my grandchildren already know how to swipe phones before they can talk.
Yeah. And I think that our fellows have been very instrumental in helping the attendings make their EMR work more efficient. You know what I'm saying? By developing macros, by developing things. So one of the things, if you're in private practice and you're in a group and you just have this stuff coming in at you, there are no fellows, let's say, you don't have that a younger age group, is to, if necessary, pay and get the resources to coach you, to help you, to whatever. I know, as you were mentioning, the scribes, and we've been doing clinical practice, as long as I've been in practice. And the interesting thing, in my current position, I don't have a scribe. All right. So, the rest of my former partners have scribes. There's a scribe there, but because of my situation, so I'm still doing it myself in the office. When I work on the floors, of course, I got the fellows and other people to provide some support. But it's hard if you go up and see a patient and you can't navigate without seeing EMRs, and we don't want to bash EMRs because there are huge problems with that. The repetitive, the data that's in the EMR, the content for taking care of a patient is actually getting worse and worse.
Well, I would say I would not go back to a time without EMR. No. The ability to connect and bring in information is. I think we as physicians, if that's a big issue, we ought to take more ownership and change it to work for us, and rather than we working for the EMR.
And I think that's a message for patients that are physicians that are looking at burnout, which is, okay, maybe it's not for you anymore. Maybe the world has changed, and you do, but it doesn't mean you have less value. It means you have huge assets that you can apply to other aspects of healthcare delivery. And maybe those opportunities are in physician leadership, they're in governance, they're in business management of a group. There are other things that I think that the changes in healthcare have actually created a lot of opportunity for physicians because of this transitions. Everybody recognizes that healthcare has to be re-engineered. And as much as administrators want to do it, they understand they cannot do it without physician leadership. And we have a lot of smart people, particularly in our space, that can really bring value to that.
Barrett, it's a great note to finish on. I think we will wrap it up. And thanks again for another enlightening conversation.
Oh, thank you so much. I enjoyed the conversation very much.
Okay.